My name is Bill Bromberg. I'm an attending trauma surgeon, which means I've completed a general surgery residency and then advanced training in trauma and critical care. I've been here since my fellowship since 2002, so I'm actually the longest practicing trauma surgeon here at Memorial right now. And what we do is we take care of the critically ill and injured patients. If the normal ER doctors think they need to be admitted or they're sicker than the normal ER doctor sees, we're sort of like the next step for the critically ill and injured patient.
Dr. Bromberg, I know that you can't talk specifically about the patients that you have here from Fort Stewart, but we know that a great deal goes into preparing to take on critical patients like those patients from Fort Stewart likely are. Can you walk us through the process of what y'all go through when you get a call that you have gunshot victims coming in is?
Absolutely. And that's really what sets a trauma center apart from non-trauma hospitals that have emergency departments. We are expected to have a very vast array of resources ready before the call comes in. So when we get a call, whether it's a gunshot wound or somebody fell off a ladder and the EMS people think they're critically injured, we get a phone call that says they're coming in 15 minutes. At that time, that phone call goes out to an attending trauma surgeon, a critical care fellow who is a resident completing more training, 2 surgery residents, usually a surgery nurse practitioner, 2 specially trained ER nurses, a respiratory therapist, a radiology tech, and a pharmacist. And they all are expected to be waiting for the trauma patient before that person hits the door. So you can imagine how much resources have to be put into that and how much preparation. We also have blood available in the emergency department in a cooler right there, so we can give people blood instantly if we need it. Our blood bank can give us the next 6 units of blood within 20 minutes of that person rolling in the door, with us having the first 2 units available immediately. So here's a plug, guys. Give blood, we need it. So go out there and give blood. What else can I tell you about our trauma system?
I'll ask you a quick question. If you're just joining us now, you can't tell us any specifics about their condition in there, but tell me what it's like when it comes to treating somebody that is a service member. Is there a heavy weight that comes with that? Treating somebody who has signed up to serve our country? I know you treat everybody the same, but there's got to be a different feel in that ER right now.
Absolutely. Savannah is well known to be a military community. Our program director, our trauma program director, my boss basically, completed a naval career prior to becoming our trauma director here. And we've always had a very deep connection with the military. It adds a couple of things. There's usually more people to talk to, right? The commanders are allowed to ask some details that, like, other, if your boss came and asked this stuff, we couldn't tell you. So we have to talk to multi-level people. We also get a great deal of support. They all come in with a buddy, so there's always somebody there with them, which is real touching for us. But yeah, we really care about our military.
And being the only level 1 trauma center here in the area, what does that mean when things like this, incidents of this magnitude happen? How did that affect your staff and your readiness, and you guys being the only ones who can do the job?
Well, we have to be available all the time, and we have to have the resources there all the time, which it costs money. I mean, that's really you imagine all those people just being ready and waiting. We do other stuff between traumas. We take care of the patients that are already admitted, but really it's a great deal of resources that are in preparation. We are the only trauma center between Charleston, Jacksonville, and Macon. That is a huge catchment area, and people come in from across the street, and people come in from hours away, and we have to be there for everybody. And the number of our major traumas has gone up since when I came here 20 years ago. We did 1,200 major trauma admissions a year, about 2,000 admissions. Like, they're not really sick enough to be called trauma, but they get admitted to trauma service. we're up to over 2,500 major traumas last year and almost 4,000 total admissions. So it's, as the population grows, so does the number of people that get hurt, and we're there to provide that service to the community.
Doctor, over the past couple of weeks, we've had a shooting at Oglethorpe Mall that required people to be treated here at Memorial. We've had this shooting on Fort Stewart today. You and your staff and everybody that works in this emergency room to treat gunshot victims, is there any, are they tired of having to treat gunshot victims? And I don't mean in the sense of they don't want to do it anymore, but is there any frustration seeing this continually come through your emergency room?
Well, it's always sad. We would all love to be able to, like me, I'd love to go teach scuba diving. That would be my dream, right? If no more people got injured, I could find something to do. That being said, gunshots often and of the type we see are young. It's just really sad, and we would like to do everything we can to prevent that. We are involved in the violence interdiction program, where we try to cut the cycle of violence when you have a shooting that may be gang related, to try to go out and prevent the cycle of shootings. So we're involved in that stuff, and that's one of the things that Level 1 trauma centers have to do, is be part of trauma prevention programs, and we're very proud of that. So yeah, I would absolutely love it if people would stop shooting each other.
And specifically treating a gunshot wound, today, what we're assuming might be some gunshot wounds, as well as, incidents we've seen in the last couple of weeks. What specifically goes into that?
Well, honestly, treating gunshot wounds can be the type of injury that requires the most technical expertise but the least amount of thought, right? If you are in a bad car accident, you can be injured and us not really see it. It can all be invisible and inside and internal bleeding. Gunshot wounds, honestly, you can think about it as there's a hole, sorry. Everything in between those holes has a hole in it. And you literally need to stop the bleeding or sew up any leakage of any other things that could be leaking, like your intestines and stuff. So it's actually, it can require good technical expertise, right? Somebody's bleeding to death, you have to stop that bleeding right away. But honestly, it's almost the least amount of mental exercise that we have to do, and we are very good at stopping that bleeding. So patients that hit the trauma bay door, if we know they're coming, we meet them at the door. They can get blood within 2 to 5 minutes if they need it, and we can get them into the operating room and operating on them in less than 15 minutes, which is a requirement for a trauma center. So we can really do that quickly. We're very good at that. And that's really what it entails. It's deciding right away if somebody's bleeding enough or has something injured that needs an operation, and getting them from the trauma bay, where we do that assessment, to the operating room where we actually fix the problem as fast as we can in a safe manner.
Well, thank you so much for your time today.